Carolina Surgical Clinic has been offering bariatric surgery to our community since 2001. We offer a comprehensive, all-inclusive program that helps patients not only lose weight, but then keep that weight off for years and years to come. Because of our philosophy, we are a nationally recognized Center of Excellence in Bariatric Surgery, and we are very proud of that designation.
Here at Carolina Surgical, we offer the three most popular operations for weight loss: the gastric band, the gastric bypass, as well as a sleeve gastrectomy. They can all be performed laparoscopically through small incisions for quicker recovery and less pain. We'll go over each of them, but first we'll cover normal anatomy.
When you eat, food goes down your esophagus and into your stomach. The stomach can hold about 1 to 1.5 quarts worth of food. It slowly pumps the food into your small intestine, where you absorb all of your calories. From there it goes to the colon, where you absorb all of your water and fluid. In the gastric banding procedure, a silicone band is placed around the upper portion of the stomach. A catheter leading from the band is brought out through the skin and attached to a port. The port is slipped underneath the skin for future adjustments. Now when patients eat, a small portion of food can fill the upper pouch completely. As a result, patients eat less. Food then trickles through the band slowly so that patients can have less hunger in between meals. If patients ever do get a little hungry in between meals, or say they can eat larger portions, we are able to adjust the band by injecting saline into the port. That inflates the cushions of the band and tightens it. Now, when patients eat, food goes through the band slower, allowing them to feel full longer and eat less. Gastric banding is a 40-minute outpatient procedure. Patients typically go back to work 1 week after surgery. The advantages of the band are that it is reversible and adjustable. Because the banding does not require any rerouting of the intestines, it does have the lowest initial complication rate of all the weight loss surgeries. The average person loses 20 to 40% of excess weight within the first year of surgery. That usually translates to 30 to 60 pounds.
One of the biggest disadvantages of the band is less weight loss. It only provides restriction. Patients that enjoy ice cream, sodas, sweet tea will find that those foods go right through the band, providing less weight loss. The band also needs frequent adjustments. We tend to see our patients back every month in the first year, and so when patients aren't able to make that commitment, then the band's probably not the right choice for them. Long term, the band has additional risks. Because it's a foreign material in your body, it can cause complications. Over time, it can erode through the stomach, slip out of position, or even get infected. There is also a chance that the band can cause the esophagus to dilate, which could cause permanent damage. Patients should understand that over a 10-year period of time, it's been shown that 30% of patients will need additional surgery to remove the band because of a complication. You should carefully consider all these risks and benefits while deciding which weight loss procedure is right for you.
The second operation we offer is the sleeve gastrectomy. In this operation, we divide the stomach and then remove the excess. By doing so, we make the stomach go from about 1.5 quarts in size down to about 1/2 cup in size. Since patients now have a smaller stomach, they can eat much less at meals.
This operation takes about 1 hour to complete. Patients stay in the hospital 1 to 2 days. The sleeve is very similar to the band in that it only provides restriction, no malabsorption. So calories that patients eat will get fully absorbed. Weight loss from a sleeve gastrectomy is usually better than a band, but not as good as a gastric bypass. The average person loses 50 to 70% of excess weight. That translates into about 60 to 90 pounds. But unlike a band, there is no adjustment or monthly visits that are needed. Another advantage of the sleeve is that there is no rerouting of the intestines, as we will see with the gastric bypass. So there is less risk of bowel blockage or vitamin deficiency in the future.
One noteworthy risk of the sleeve is leakage. Since the new stomach tube is constructed of a row of staples, leakage can occur anywhere along that staple line. The risk usually only lasts for 2 weeks, and once patients are beyond that 2 weeks from surgery, they're usually out of the woods for that complication. Another disadvantage of the sleeve is that reflux symptoms and heartburn can worsen after the procedure. The third operation that we offer is the gastric bypass. Here a small pouch is created in the upper part of the stomach. It is approximately the size of an egg or 2 tablespoons. That allows patients to eat less food. Next, the small intestine is divided and brought up to the pouch. That creates a bypass. The bypass makes it so that patients absorb fewer calories from what food they do eat. In this way, the roux-en-y gastric bypass works by 2 mechanisms. 1, patients eat less food, and 2, they absorb fewer calories from what little food they do eat.
The roux-en-y gastric bypass takes about 1 to 1.5 hours to complete. Patients typically stay 1 or 2 days in the hospital and can resume their work in 2 weeks. The gastric bypass should be thought of as irreversible and non-adjustable. The gastric bypass usually offers the best weight loss of the 3 discussed here. The average person loses between 60 to 80% of their excess weight. That usually translates into a weight loss of 90 to 120 pounds. Gastric bypass patients tend to lose more weight because they are not only eating less food, but they are also absorbing fewer calories from what they do eat. Some of the advantages of a gastric bypass are that it does not need any adjustments. Also, patients should experience less reflux. It works by 2 mechanisms, restriction and malabsorption, so it provides the best weight loss of the 3 operations. One of the disadvantages of a gastric bypass is a higher upfront complication rate. One such complication is leakage at one of the bowel connection points. There's about a 1% risk of this complication, but it can be life-threatening and does require additional surgery to fix the problem. Because we reroute intestines during the surgery, there is an increased risk of bowel obstruction. Persistent abdominal pain, nausea, vomiting can be a sign of this and should be a sign to contact your surgeon immediately. Bowel obstructions often require reoperation to fix the problem. Some gastric bypass patients also get dumping syndrome, which is a feeling of nausea, abdominal pain, and sweating after eating sweet foods. Finally, gastric bypass does carry a higher risk of vitamin deficiency than gastric banding or sleeve gastrectomy. It is critical to take your vitamins every day after weight loss surgery. Failure to do so and failure to follow up with your surgeon could result in a vitamin deficiency and permanent critical illness. Calcium deficiency can result in bone thinning and easy fractures. Low vitamin B12 can cause permanent nerve damage, and iron deficiency can result in anemia. Women of childbearing age can become deficient in folate, which can cause birth defects. By taking your vitamins and coming in for regularly scheduled follow-up visits for the rest of your life, these vitamin deficiency risks can be minimized considerably. You should also be aware that birth control pills may not work as well after gastric bypass surgery. Since we do not want you to get pregnant in the first year after surgery, we strongly encourage alternative methods of birth control.
All of these weight loss surgeries are major abdominal surgery. They are not cosmetic surgery. For that reason, they carry the same risks as any other major abdominal surgery. Those risks include, but are not limited to, bleeding, infection, injury to the intestine or nearby organs. There's also a risk for developing blood clots in the deep veins of the legs.
In addition to weight loss, bariatric surgery also improves many medical conditions. After gastric bypass, diabetes improves 84% of the time, and hypertension improves 68% of the time. There is a better than 80% chance that sleep apnea and high cholesterol will improve after gastric bypass. Gastric banding in the sleeve can improve these medical conditions as well, but the odds are not as good because the weight loss is not as good.
As a recap, the weight loss from a gastric banding procedure is the least. The sleeve causes better weight loss, and the gastric bypass typically produces the best weight loss. The better the weight loss, the more likely other health problems like diabetes and high blood pressure will improve or resolve completely.
Helping you achieve your weight loss as well as improving your medical conditions is what our goal is. We want you to live a long, happy, and healthful life. We will be your physician partners through this journey, and we thank you for entrusting Carolina Surgical with your weight loss surgery.